If you have particular dietary restrictions or health conditions, consulting with a healthcare professional for personalized guidance can be beneficial. Saccharin is an artificial sweetener that has been used for over a century as a sugar substitute. It has a controversial history, and opinions about its safety and potential health effects have evolved over the years. Here's a summary of the potential advantages and disadvantages associated with saccharin. The potential benefits of saccharin. Low in calories, saccharin is calorie-free, making it a suitable option for people looking to reduce their calorie intake and manage their weight. Diabetic-friendly, saccharin does not significantly affect blood sugar levels and can be a helpful sugar substitute for individuals with diabetes or those trying to control their blood glucose. Long history of use. Saccharin has been used as a sugar substitute for many years, and extensive research has been conducted on its safety. It is approved as a food additive by regulatory agencies in many countries, including the U.S. Food and Drug Administration, FDA. No impact on dental health. Saccharin does not promote tooth decay, as it does not provide a food source for bacteria in the mouth. Laboratory studies have linked saccharin at high doses with the development of bladder cancer in rats. However, mechanistic studies that examine how a substance works in the body, have shown that the ways in which saccharin causes cancer in rats do not apply in humans, and in 2000 it was removed from the list. The potential concerns or disadvantages of saccharin. Bitter aftertaste. Saccharin is often associated with a bitter or metallic aftertaste, which some people find unpleasant. Historical health concerns. In the 1970s, saccharin was linked to bladder cancer in laboratory rats when consumed in very high doses. As a result, saccharin was temporarily banned in the United States. However, further research has indicated that the mechanism of cancer formation in rats may not apply to humans. Consequently, saccharin was delisted as a potential carcinogen in the US. Phenylketonuria, PKU. Saccharin contains phenylalanine, an amino acid that can be harmful to individuals with phenylketonuria, PKU. People with PKU lack the enzyme needed to metabolize phenylalanine, and consuming saccharin can lead to an accumulation of phenylalanine in their bodies. Therefore, individuals with PKU should avoid saccharin. Safety in extremely high doses. While saccharin is considered safe for most people when consumed within acceptable daily intake ADI levels established by regulatory agencies, there is still some debate about its safety when consumed in extremely high doses. Studies in rats and mice have suggested a potential link to cancer under these conditions. However, such high doses are far beyond typical human consumption levels. Other sweeteners available. Some individuals prefer the taste and properties of other artificial sweeteners, such as aspartame, sucralose, or steviol glycosides from the stevia plant, which may be more palatable to them. In summary, saccharin is considered safe for most people when consumed within recommended levels. However, it has a history of controversy due to early studies linking it to cancer in rats. Subsequent research has largely dismissed these concerns, and regulatory agencies have approved its use as a food additive. Some individuals may dislike its aftertaste, and it may not be the sweetener of choice for everyone. As with any dietary choice, individual responses can vary, and if you have specific health concerns or conditions, it's a good idea to consult with a healthcare professional for personalized guidance on the use of saccharin, or other sweeteners in your diet. Up above you see a video relevant to this. Watch that and it will help your health. Please don't forget to click the like button and subscribe.